Our next speaker is Dr. Matt Jorgensen. Dr. Jorgensen completed his bachelor's degree at Cornell University. He has a pretty diverse background and diverse experiences, maybe a little bit unusual compared to some of the other speakers that we have today. During his undergraduate degree, he had internships at the Minnesota Zoological Gardens as well as the San Diego Zoo. And he spent 3 years working as a hand trainer at the Cornell University Raptor Center, which I believe is Birds of Prey, not Jurassic Park, Matt. He completed his master's degree at the University of Edinburgh in applied animal behavior and animal welfare, where he designed and executed a research study combining historical data and behavior observation methods to assess the role of maternal traits and mothering ability on reindeer calf survival. He also collaborated with farm owners and workers to identify welfare and productivity issues in a herd of reindeer in the Scottish Highlands. Upon completion of his master's, he returned to the US and did his PhD at the University of Minnesota, focusing on automated calf feeding systems for dairy calves in the upper Midwest. And following his PhD program, he was a postdoctoral fellow at Iowa State University, where he completed the development of animal welfare, or collaborated on the development of animal welfare training programs for veterinary students and on-farm welfare assessment of dairy farms and swine units. Dr. Jorgensen recently began a position as a research animal scientist in animal behavior and welfare at the USDA. He uses physiological, behavior, and epidemiological analyses to develop scientific measures of animal well-being and determine the impact of agricultural production practices on animal welfare outcomes. He is speaking to us today about best practices for automated calf feeding systems. And with that, I will before I turn the floor over to Matt, just a reminder, you can ask any questions by leaving them in the chat box next to your YouTube video stream. And you don't have to wait till the end of the presentation to do that. So you can feel free, if you have questions that pop up throughout, I will pass them on at the end, but you can feel free to leave them at any time in that chat box there. And now with that, I'll hand the platform over to Matt.
Thank you, Gail. Can you hear me all right? Good, yeah. Okay. So as Gail noted, I'm going to be speaking today about best practices for automated feeding systems, or trying to at least. Okay, there we go. So we all know that the calf represents really the future of a dairy farm operation. The investment that gets put into those young animals ranges anywhere from $1,200 to $1,600 from the birth of a heifer calf to her giving birth to her own first calf and joining the productive herd. So that comes out to somewhere between $1.40 and to $1.88 a day. And so it is a significant investment by the farmer in that animal. We also know that during the pre-weaning period, calves are at the highest risk of any animals on the farm to experience morbidity and mortality events. Now, morbidity, they might recover from a disease issue, but just experiencing those events can lead to reduced growth, lead to future health issues. If it's a respiratory disease issue, they can damage their lung tissue permanently. And all of those can combine to limit future productivity of the animal. And then, of course, if that calf dies in the pre-weaning period, that represents a total loss of a significant investment in that animal. Now, to protect this investment, producers have conventionally kept calves in individual hutches. Limiting calf-to-calf contact is thought to help prevent some transmission of disease in these animals and keep those animals alive. But despite this system, what we see is still a 5.8 to 8.1% mortality rate in the dairy industry. So that includes all housing systems, but because it's primarily made up of these individual hutches, we see that there are still big issues with mortality in the dairy industry. We also know that the steps leading up to a mortality event represent a pretty serious welfare challenge. They are unpleasant events to go through for those young animals. Now, despite the perceived benefits of keeping calves in individual hutches, there's an increasing pressure to start shifting away from that system. Raising calves in hutches is a significant suck for labor and potentially, at least in Minnesota and the upper Midwest in the winter, leads to exposing farm labor, often family members, to potentially hazardous conditions. There are also some pretty serious welfare concerns in the individual hutch-based housing system, including limitations on the calf's ability to move around and interact with other animals. We know that for gregarious species like cattle, being kept from conspecifics is a welfare problem. Now, all of this has combined to lead to a growingly negative public perception of individual housing systems for dairy calves, and even some legislation outlawing those systems in Europe specifically. So the automated feeding system is an increasingly popular tool for farmers as they shift to group housed systems. Specifically, farmers choose to install these automated feeding systems because it eliminates a lot of very tedious manual labor of washing and filling bottles, delivering those to individual animals. It also enables producers to more closely monitor individual animal status within a group housed setting. So they can track individual calf behaviors over time to better identify sick animals. And then, of course, shifting to an automated feeding system allows the producer to provide a more natural feeding pattern for their calves. So as I said, the producers are changing in large part to redirect labor. They are able to manage the animals rather than spend time doing menial tasks. They are provided with a lot more data about those animals than they would get in a group house system otherwise. And an increasing number of producers also note that addressing these animal welfare concerns in the public is part of their reason for switching. For those of you who are not familiar with these automated feeding systems, this is what a typical setup looks like. Essentially, this young calf walks into the chute where an RFID tag either on the calf's ear or on a collar identifies that individual animal. The machine then determines whether that animal has any milk allocated for that time of day or that particular meal, dispenses either a milk replacer powder or a whole milk into a mixing tank, blends it up, warms it to cow body temperature, and then delivers it to a nipple where the calf can suck. These systems also are able to track not just overall intake of calves per day and per meal, but they are also able to track drinking speed and the number of visits, both rewarded visits where the calf gains access to that milk meal or unrewarded visits where it does not. So there are some potentially useful behaviors being tracked on the automated feeding system. Now, for today's talk, I'm going to be drawing information from a number of studies, not just my own work, but from other studies that have been conducted at Minnesota, up at Guelph, and in Europe, and British Columbia. There are a lot of automated feeder studies that are out there now, but specifically to orient you to the data from my research, we focused on gathering the largest sample size possible to identify risk factors for adverse health and welfare of calves in these systems across 144 different variables on farm. We visited 38 farms over 18 months, up to 8 times each, and scored, used the Sheila-McGurk's health scoring system on almost 10,200 individual animals. And I want to orient you to my data specifically because what we found is that there's a huge amount of variation between farms in the health and welfare outcomes of their animals. So across that health scoring system, we saw farms performing both very strongly and very poorly relative to their calves' health outcomes. We also saw, in general, a good mortality rate, a lower than national average mortality rate at just under 4%. But we saw, again, a lot of variation between farms, with some of our poorer performing farms losing over 13% of their calves every year, which is a lot to lose when you consider that investment that we talked about previously. Now, gladly, a number of our farms were below that 3% mortality rate, but 13% had more than 7% of their calves dying every year. We know that there's a lot of variation in the systems that are being used. And then we wanted to look at what are the risk factors that are setting calves up to either succeed, maintain good health and growth through that pre-weaning period, or fail, have a morbidity or mortality event. And so what I'm going to talk about today specifically are factors that fell into some critical categories in both my research and some research that my colleagues have done elsewhere. Specifically, we're going to ask what are the best practices for these systems? What is currently being done? How are calves housed and managed and fed in these automated feeding systems? What risks are we aware of and can mitigate for? And then I'll leave you at the very end with just a couple of ideas of where research and improvements are going to be going relative to automated feeding systems. Specifically today, I'm going to focus on 4 main categories: dietary management, so managing the nutrient access for those calves, how able we are to detect disease in those animals using the behaviors tracked, what are the stocking practices of these farms, how do they group calves, and what is working and not working. And then finally, I'm going to leave on cleaning, which I think is historically is one of the biggest issues in automated feeding systems. But first, we'll start where all the nutritionists want to start, that dietary management of these calves. One of the big benefits of using an automated feeding system is that a producer gains access to a lot more flexibility and potential to individually manage animals relative to conventional feeding systems. You can set up calves on different planes of nutrition, different schedules, and really tailor those diets to the animals. As producers are setting this up, though, they need to consider a number of factors that go into setting up that diet plan. Specifically, they need to identify where they want peak milk to fall, how much milk calves should be allowed to get per meal, how fast those changes are made, and then finally, how they can start weaning calves off to avoid a dip in growth once calves are finally off of milk. What we see in both the US and in Canada is that producers using automated feeding systems are already feeding a much higher plane of nutrition than conventionally housed animals. So in the US, on our study, we observed that the peak milk allowance averaged just over 8 liters per day. In Canada, we see a similar relatively high peak milk allowance at just under 10 liters per day. What's worth noting, however, is that there's a lot wider range in the United States in terms of the amounts being fed to calves compared to Canada. So whereas most farms in Canada, the great majority, are feeding at least 8 liters per day at that peak allowance, we find some producers in the United States are still essentially limit feeding their calves, peaking at just 5 liters. I would say that's not typical of farmers using automated feeders, but it is an issue in the United States. Now, interestingly, what we're seeing is that this peak milk allowance is associated with health outcomes. So specifically, we know that feeding a higher plane of nutrition supports immune function in young calves. And what we saw is that for farms feeding a higher peak allowance, there was actually a protective relationship of that plane of nutrition with calf health. So they were 12% less likely to get a high score on a scour, the scour mark on our health scoring system. What's interesting here, again, is that Canada didn't observe that difference in recent work. They did not see an impact of milk allowance, but it's really worth noting that because almost all the farms in Canada are already feeding a relatively high plane of nutrition for automated feeding systems, at least, there's likely a diminished impact of going above that 9.7 liter floor. We also saw in our own work that the speed with which a farm farm reaches peak allowance has an impact on the health outcomes for calves on that farm. Specifically, we saw that a faster speed to reach that peak allowance was related to better health across the board on that health scoring system. This is actually consistent with some work by Anne-Marie DePassier up in Canada, where she showed that feeding calves more during the first 4 days after birth reduced the risk of them becoming sick through the entire pre-weaning period. So some other work has focused on how feeding this higher plane of nutrition actually influences calf behaviors. And Emily Miller-Cushion and others have done some really great work on comparing what a restricted fed calf will do in these systems compared to those that are fed at a higher level. Specifically, what's been seen is that limit-fed calves actually consume fewer meals over the course of the day. They consume those meals immediately once they are available, and then they actually spend a lot more time visiting the feeder without getting a reward. And that time that they spend in the feeder chute is time that another calf could be feeding. And so actually restricting their milk allowance is reducing the overall efficiency of the systems. From a welfare perspective, we also can see that these behaviors indicate a hungry animal. And we know that hunger is an unpleasant affective state for those animals to be in. So restricted feeding in automated feeding systems might not make great sense. In comparison, when we look at animals that are fed a larger meal size, above 6 liters per day at least, we see reduced competition for the feeder access. Calves are less likely to monopolize that feeder, and you actually get more efficiency of the feeder use in larger groups of calves. So it allows the machine to manage a larger group more effectively. There has also been some work showing that reaching a peak allowance sooner in the calf's life will lead to higher overall milk intake in the pre-weaning period, which makes sense. If you are giving them access to more milk earlier, they are going to drink it. But there hasn't been a demonstrated long-term impact in growth of doing that. Now, the flexibility in feeding calves is reflected in the flexibility that these machines have in weaning calves as well. And this is, I believe, one of the more positive aspects of automated feeding systems. So the goal of a weaning program, regardless of system, is to get a calf off of milk and onto its starter diet to promote good rumen development and try to avoid a dip in growth around that weaning event. And studies recently have shown that a more gradual weaning schedule helps promote both a better growth of the gut. The rumen development is better in calves that are gradually weaned compared to those that are abruptly weaned. And we actually also see increased starter consumption and a reduced impact of that growth check at weaning. We also know that there's a lot of variation between calves in their ability to transition onto grain. So being able to tailor a weaning strategy to the calf based on things like starter intake rather than age might also provide us with benefits like reducing overall milk consumption, promoting higher grain intake and growth in those animals. And this is where the automated feeding system really shines. It can actually be paired with other automated systems like an automated grain feeder to wean based on things like starter intake rather than just the animal's age. So when we talk about feeding calves on automated feeding systems, what we really want to do is avoid the traditional limit feeding that we see in hutch-based systems. We know that it's associated with behavioral indicators of poor welfare. We know that it diminishes the efficiency of automated feeding systems. And we see that it actually allows, limits the utility of behavioral alerts. And I'll talk about this a little bit more in the next section. And then finally, we are able to feed higher amounts of milk sooner. There's really no reason to limit feed early in life. So my recommendation would be to essentially start those calves at least 8 liters per day and keep them at a high level throughout until you get to a weaning event. When you do get to the age that you're going to wean those calves, try to do it gradually. Ideally, you want to do this over several weeks. I would say at least 3 to 4 to promote a smooth transition onto a full grain diet. And what we're seeing in recent years is manufacturers taking some of these suggestions and actually implementing them in their recommended practice. So Forster Technic is one company that manufactures automated feeders, and they've developed this 40 fit concept that starts calves at a high plane of nutrition and weans them off gradually at the end of that pre-weaning period. So it is starting to be taken up in the industry. So I mentioned earlier that being able to detect disease by tracking calf behavior is one of the reasons that producers are putting these machines in. And there is some evidence that changes in calf behavior can alert producers to a health event before that animal might be displaying obvious signs of illness. So as a reminder, again, the automated feeders record daily and per meal consumption volume, in addition to the drinking speed of the calf and the number of rewarded and unrewarded visits. So the question there is, which of these behaviors is most useful in identifying sick animals? And perhaps a bit counterintuitively, the overall consumption is generally not shown to be the most robust indicator of a sick animal. So some work by Dr. Whitney Knauer at the University of Minnesota actually showed that drinking speed will drop significantly up to 3 days before a diarrhea event and on the day of a calf being identified with a respiratory illness. And in our work, we saw that farms that reported using drinking speed as their primary alert had a significantly lower mortality rate than those that didn't report using that indicator. So drinking speed might be an area to focus on. Some other work has also shown that the number of unrewarded visits, so times that calf is in the feeder chute but does not get access to a milk meal, might be a relatively sensitive indicator of calf health. So it's been shown that calves decrease the number of unrewarded visits up to 2 days before clinical signs of respiratory disease and 2 to 3 days before a diagnosis of an enteric infection. And here is where the amount that you feed a calf actually matters, because limit-fed calves are so motivated to access that small amount of milk that they get that they actually demonstrate a smaller change in behavior relative to a health event. So if you're not feeding calves at a high plane of nutrition, you may not actually be able to observe a behavioral change using the automated feeder. So we know that at this point, disease detection lacks a little sensitivity. These behavioral indicators on their own are not probably sufficient to track animal health. But what we are thinking is that intake alone is not going to be your best indicator of a calf health event. Rather, you should be focusing on drinking speed and those unrewarded visits if you are trying to identify sick calves. You have to be aware that limit-fed calves might not change their behavior significantly enough. And just an absolutely critical thing with installing these automated feeding systems is that it doesn't replace the calf manager. That individual still needs to get visual assessment of those animals every day. The automated feeder is a complement to a good calf manager. It is not a replacement for one. The calves in automated feeding systems are actually typically backgrounded in individual pens or hutches for about 5 days prior to being put into the group housing system. The reason for doing this is that older calves are quicker to learn how the automated feeder works, and so there's less labor in training them. But what waiting for 5 days actually does is reduces the overall utility of the automated feeding system. Some work out of Guelph has actually shown that introducing calves on the first day of life, the those calves require more assistance to train to the feeder before they learn how it works. But when compared to feeding in two separate systems, the individual hutches and the automated feeder, it's actually less overall work for farm labor to go in and assist those calves more frequently. A couple things that we saw in our study in Minnesota, Wisconsin, and Iowa is that really early life experiences are also pretty critical. So serum total protein, that indicator of colostrum management, is still a problem on farms using automated feeding systems. So for our 38 farms, we saw an average serum total protein of 5.4 milligrams per deciliter, which is above the typical recommended value of 5.2. But we did see a number of farms that fell below that. And we saw a significant relationship between serum total protein and the mortality rate on farms. So farms that had lower serum total protein had more calves die. That makes sense. It's been an issue in the dairy industry for a long time, but it remains one here. We also saw that farms that disinfect the navels of calves using iodine had a significantly lower mortality rate than those that didn't. So even before you're putting calves onto the automated feeder, you still need to be paying attention to these critical early life practices. Once you're in the group housing, a lot of producers are curious about what the right group size is. And really, it's not totally clear how group size and health events are related. There are studies that show that larger groups might have a higher risk of respiratory disease, but there are contradicting studies that show that there's no difference, at least between small groups and individually housed animals in terms of health outcomes. And as Jeff Russian would put it, really the management of the systems is the most important factor rather than what type of system you're in. For our study in Minnesota, Wisconsin, and Iowa, we actually, this is a visual representation of every single pen of calves that we observed. And what we saw is that on average, farms are stocking these pens at just under 18 calves per pen, and that they're allowing each calf over 4.5 square meters. It's worth noting that that 4.6 square meters is significantly above the 2.8 square meters that's typically recommended. And what we saw is that while a larger group of calves had a relationship with increased nasal scores, so an increased likelihood of calves having discharge from the nostrils, we actually saw a protective effect on the cleanliness of the calves, so evidence of scouring. So it's, again, not totally clear from our work what the size of the group should be, but because that 17.8 animals per group is lower than the maximum manufacturer recommended stocking density, I tend to recommend smaller groups. What we did see is that stocking animals at a lower density also had a protective impact on those health scores. So we saw fewer animals with high ear or eye scores in pens that were stocked less densely. And then we also saw a relationship between the age range between the youngest and oldest calf in a pen and the mortality rate on farm. So on average, the difference was 3 weeks between that youngest animal and the oldest animal. And those farms that can narrow that band had better mortality rates. We also saw that there is a seasonal impact in these group house systems, with winter and fall tending to be the worst. So we observed higher morbidity and mortality in the winter and fall seasons, which is consistent with what the literature has shown previously. Now, the season is important because in winter and fall, when the air gets colder, some producers will tend to shut down ventilation in their barns, and we cannot recommend doing that. So this is just the distribution of the types of barns that we studied, but 87% were using positive pressure ventilation systems throughout the year. And what's important is that farms that have these positive pressure systems are significantly less likely to have calves scored as being sick. So when we're talking about barn and stocking best practices, we want to maintain that high quality postnatal care, focus on colostrum management to help buffer against potential infection in that group housing system. Keep the group size as small as possible, but perhaps more critically, maintain as narrow an age range in the group as you can, and provide that supplemental ventilation even in the winter. And then finally, focus on cleaning. Cleaning is absolutely critical. In our study, we took milk samples from both the mixing tank, where the milk replacer is blended, and from the tube end just prior to the nipple, where the calf is sucking. And when you compare our top 10 performing farms, you see bacterial counts, both standard plate counts and coliform counts, that fall well within the recommended ranges for contamination. So those ranges are up to 100,000 colony forming units per milliliter for standard plate, and up to 15,000 colony forming units for coliform bacteria. And you can see that those top performing farms are doing a great job, while the bottom performing farms are doing an absolutely terrible job. And I started this study actually mouth pipetting some of the samples from the mixing tank. And once we got our first numbers back, I immediately stopped that practice because yikes. So the question is that contaminated milk associated with sick calves? And the answer is yes. Farms that had a high colony forming units per milliliter versus those that were normal had worse scores for calf attitude, their affect, or their ear scores, and more likely to have calves categorized as being sick. So we know that the cleaning is a problem. And that problem arises from producers misunderstanding what these machines are capable of or what they do on their own. So really, there are three functions that need to have attention paid to them when cleaning. There are the automated functions that run a number of times every day. Those work quite well, but they don't actually clean a number of the valves and tubes within the system. There are also circuit cleaning functions that the producer has to start themselves. And then they need to be really on top of cleaning and frequently changing tubes, valves, and nipples on these machines to keep them clean and make sure they're not feeding calves a contaminated meal. Another factor of cleaning is the pen itself, and we actually saw that farms that disinfect pens between calf groups had a significantly lower mortality rate. So we would recommend, if possible, stocking animals as all in, all out, and being able to clean pens between groups rather than a more dynamic grouping system. And then again, we saw a trend for a high bacterial count to influence mortality with higher bacterial counts associated with higher mortality. So we know that auto feeders are prone, like all feeding systems, to biofilm buildup. So you need to be cleaning those frequently. You need to be focused on the non-automated functions of the feeder unit. So manually cleaning and replacing tubes and valves at least once per week, if not more. If you're feeding pasteurized waste milk, or if you're feeding waste milk, pasteurize it. And clean the storage tanks as well. We saw some scary bacterial counts coming from waste milk in our study. So in summary, excellent colostrum management in early life, disinfect that navel as soon as you can, feed more milk sooner, and make sure that that milk is not contaminated by bacteria. That means cleaning. I cannot emphasize it enough. When you wean those animals, try to do it gradually, over several weeks if possible. This will help you improve grain consumption, improve ruminal development, and avoid that weaning drop in daily gain. If you can, clean and disinfect those calf areas and make sure that they are well ventilated, even in fall and winter. If you're concerned about calves being too cold, don't turn down the ventilation. Just add more bedding to those systems. If you can keep calf group sizes small, it is likely safer to do so. If you can keep the age range in those groups narrow, it is likely safer to do so. And if you can provide calves with more space, they're less likely to come into contact with infectious materials. And so finally, what's next? I think there's going to need to be more work on what cleaning strategies are the most efficient for these automated feeding systems. There's been a lot of improvement already, but there's still work to be done there. And then we're curious about how can we support that calf transition into the group to minimize labor and maximize that animal's robustness in a group housing system. And then I think very interestingly, we need to improve the sensitivity of these machines to detect sick animals. How can we integrate it? It's great going right after Dr. Cabrera, talking about data integration. How can we integrate the behaviors from the automated feeder with other technologies on farm, activity monitors, rumination sensors, that sort of thing. And then finally, we need to understand if there are heritable animal traits or observable phenotypes that do better in automated systems. And so something that I'm hoping to pursue in the near future is whether there are tech-savvy animals that do well in automated feeding systems, and if we can select for them, and then if those animals go on to also be more successful in future automated systems like a robotic milker. So I think I'm just about right on time. I will say thank you all for joining, and I'm happy to take some questions.
All right, thank you very much, Dr. Jorgensen. So like I mentioned at the beginning, if you guys want to leave any questions, you can drop them in the chat box and I'll read them off. I guess I'll get started. You kind of started talking about this a little bit towards the end of your talk there. And I'll ask you the same question that I asked Dr. DeVries. So if we're talking right now about, we're kind of loosely categorizing all of these talks as technology, automation and technology, where do you see in the future, what are you really excited about technology-wise, where we're going regarding automated calf feeding systems?
Yeah, I think the most exciting place that I see it going is in integrating the data that these systems collect with the data that we can collect from other systems. And Dr. Cabrera talked about the need for standardization. It is currently pretty tricky to get the data from a calf feeder to work well with data from an activity monitor system. I know Joao Costa in Kentucky is doing a lot of work with precision technologies for dairy calves. And so I'm excited to see what his lab produces in the near future. But yeah, I think finding ways to get the information to work well with other systems and then provide us with more capability to identify animals that need extra attention or to identify them sooner in the process.
Mm-hmm. What do you think? You mentioned, you talked a bit about stocking density. You also talked about number of animals in the group. Which do you think of the two is the more important predictive factor in terms of animal performance?
So based on the evidence that I've seen, I think that stocking density is pretty critical. I have actually, I have seen farms stocking very large groups of calves and still having good success, very low mortality rates. So I think it's as long as those pens are well managed, kept clean, and the animals have the space that they need, those large groups can succeed. I am a bit leery to say that large groups are good because there is an increased risk. But under good management, I've seen them work fine. So I would focus on my farm, if I had one, I would focus on stocking density rather than group size. But I mean, the two go hand in hand. So.
Mm-hmm. I'm interested to pick your brain a little bit about solid feed. You talked about that earlier in your presentation. And I wonder if it's a little bit chicken and egg, and maybe you can shine some light on this. So you mentioned that there's a lot of variability in starter intake, in particular when calves are starting up, and that maybe we can use some of those automated technologies to tailor our weaning strategies to calves that are eating more or less starter.
Yep.
How do calves learn to eat starter? Because I always assumed that it had a little bit to do, at least, with hunger. And so if we're increasing the amount of milk that we're feeding them because we don't want to limit their energy intake and they haven't started eating starter yet, are we actually keeping them from eating more starter in the future? Or how do you, as a behaviorist, do you have any comments on that?
Yeah, so feeding more milk early in life does result in less grain intake. That's, I think, been fairly clearly demonstrated in the research. But early life grain intake is pretty limited anyway. So in the first couple weeks, calves just aren't eating that much grain, regardless of how much milk they're getting. And so those gradual weaning systems introduce that motivation a little more slowly than a traditional weaning system would to get calves interested once they are at an age where they can and do eat more. So I think it is tempting to say, well, if you feed more milk, they're not going to eat grain, and if they're not eating grain, the rumen's not going to develop, and you're going to have problems when they are weaned. And that's the traditional way of looking at it is, if we limit their milk, they will eat more grain. But I think what we're seeing is that it's the patterns of providing those two types of nutrition that are critical in a smooth transition to a ruminant animal.
Okay, thank you. Do you have any recommendations about solid feed practices, management practices to kind of encourage some of that feed intake aside from the gradual weaning?
Honestly, not really. I have seen some work trying to identify factors that might motivate calves to eat more solid feed when they're young, but aside from providing a high quality textured grain diet, that would be my approach to it. I don't know that there's a ton that can be added to that to improve intake. But yeah, no, I guess is the short answer. I don't have a ton of recommendations for that.
Is there a way that we can leverage some of you talked about learning, you talked about older calves being able to learn more easily, but younger calves can also learn from older calves. But you also mentioned, that the wider in age range you see in those pens, you have an increased risk of mortality. Is there a way to leverage some of that learning from older calves onto younger calves and help them kind of pick up the system a little bit faster?
The way the systems are typically set up now, I would say that it's relatively limited. So there is an aspect of social facilitation in feeding behavior in calves. If they see another calf feeding, they are more likely to perform that same behavior. But because most pens only have access to a single feeder chute, or at most two, then there are some limitations to how much a calf can learn. Really, it is the reward of receiving milk that reinforces that behavior more effectively than seeing other calves do it. So it is just the factor of getting up and learning that they can access milk through the feeder that is the most effective part. So.
Okay,